Hello, my name is John Atwood with Coastal Infusion Services. We're located in Madisonville, Louisiana. Some of you may be going home on IV antibiotics. We are an infusion pharmacy that will be providing you medication and supplies. You may be receiving your supplies and medications in person at the hospital, at your home, or via mail. At the home or in the hospital, they will come in a bag like this with our information on the front. If in home, it'll probably come in a box. Inside the box or the bag, whichever you receive, you will have a folder. In the folder will be our contact information, which you will notice is on the front of the folder. Also, there's a card with the name of our pharmacist in charge, Hunter Fair. Also, there will be paperwork you will need to sign, which will be a delivery ticket. They'll look like this. There'll actually be two, one you sign and send back, and then the other you'll keep as a receipt. And also there will be a plan of service agreement. It will be highlighted where you need to initial and sign and date. Also in the folder will be a education sheet, which you will use for administering your medication. And then there will be a patient bill of rights and responsibilities just for reading. Also in your bag will be a tin foil type insulated container with an ice pack and your medication. Your medication will look like this. These are pre-filled balls with your antibiotic. They may be this size or they may be a little bigger depending on the quantity of medication that you're getting. You will need to, these balls will be in a Ziploc bag inside of the tin foil insulated bag. You will take the Ziploc bag full of these medications and put them in your refrigerator. You will remove one of these roughly 1 hour before administering, laying it on the table and allowing it to come to room temperature. Also in the bag will be a box of gloves with a perforated top. You simply press it in and remove the top to get your gloves out. Also in the bag will be the supplies needed to administer the medication and maintain your PICC line. Supplies you will be using will be 10 cc pre-filled normal saline syringes with a white cap. You will have a 5 cc pre-filled heparin flush syringe with a yellow cap. You will also have a separate package with alcohol preps and a green medicated cap. The remainder of your supplies will be, say, for your home health nurse who will come out and do your dressing changes weekly and possibly draw labs as needed. Next, we want to prepare our surface. You can use a table, a bar top, TV tray, as long as the surface is clean. You can clean by using bacterial wipes, sanitizer, or just plain soap and water. Your teaching sheet here is written so that you could more than likely administer your medication without our help altogether. You want to lay out your supplies from left to right. A pair of gloves, an alcohol prep, saline syringe, alcohol prep, the antibiotic, alcohol prep, saline, alcohol prep, heparin, and a green cap. This is called the SASH protocol. It's an abbreviation that stands for saline, antibiotic, saline, and heparin. I would suggest laying this in front of you to use as a reference. At that point, we want to wash our hands for 30 seconds with soap and water. Apply our gloves. First, tear your alcohol prep so it's easy to get to. Take out your pre-filled saline syringe, remove the cap, open another alcohol, and at that point, depending on which type of access that you have, you may have a midline which will only have one lumen or one tube coming from your dressing site, or you may have a PICC line which will either have one lumen or it could possibly have 2 lumens. These may also have a clamp on the tubing below the connection here. We grab the clave or the blue portion of the line, we remove the green cap. Get an alcohol prep, and we clean the tip of that around the threads and across the tip for roughly 20 seconds and allow it to air dry. We connect the saline syringe by pressing into the clave and turning until it's taut. At that point, we want to open all clamps. You open this clamp by pulling the top lip away, which releases the flat portion of the clamp. If you have a purple clamp, which will look like the white clamp except for being purple, you open it as well by pushing away the lip. At that point, you administer the saline in short bursts. When you get near the end, you stop. Roughly when there's 2 to 1 cc's left. This prevents the air bubble that will be that you may notice at the top of the syringe from going into the tubing. As long as you leave the plunger facing up, the air bubble cannot go into the tubing. We grab our next alcohol prep, clean the top of the clave for 20 seconds, allow it to air dry for 10. Grab our medication ball. There will be a paper wrapper that we remove, and also a safety cap. We remove the safety cap from the ball. It will look like this when the tubing stretches out. At that point, we connect the tubing to the clave the same way we did the syringe, pressing in and turning until taut. At that point, we open the clamp on the IV antibiotic by pressing the top tongue away. You will hear it click. At that point, your medication is infusing. This ball works by gravity, so you do not need to hold it up. You do not need to squeeze it. You can lay it beside you if you're on the couch or in your bed. If you need to get up and get something to drink or go to the bathroom, you can simply put it in your pocket or carry it with you. When the medication has completed, it will be shrunk down looking like this. So if you have a 30-minute infusion, after 30 minutes it should look like this. You can always check during the administration of the medication when you start here. It should be about half the size between here and here to know that the medication is infusing. If the size of this ball has not decreased, check your clamps again to make sure you've opened all clamps. Once it's infused, just simply close the one that's for the IV antibiotic, close it back, or you don't have to close it back. The medication should be infused and should not leak. Before discontinuing or disconnecting, open the remainder of your supplies. Alcohol prep, just like you did originally. Saline, remove the white cap. Alcohol prep. And your heparin flush, which is a diluted blood thinner to keep the blood from clotting in the tubing. At that point, we're going to disconnect the antibiotic line. Swab again with saline, 20 seconds. Allow to air dry for 10. Saline syringe, press and turn. Short burst. Remember to keep the plunger up, which allows the air bubble to stay at the top. When you get near the bottom, there'll roughly be 1 to 2 cc's remaining. You'll see it numbered on the syringe. Take off your saline. Swab again. 20 seconds. Allow to air dry for 10. Connect the heparin. In the heparin, there's going to be 5 milliliters. You want to just press this steady, once again, until you get near the bottom with 1 to 2 cc's left, which you can see on the syringe, and stop. At that point, you will get your green cap. It pulls away from the strip. It's medicated. You'll screw this on to the end. At that point, you want to close all clamps by pressing in the flat part of the clamp till you hear it click or it's under the lip on the upward tongue. Also remember to close the clamp at the bottom if you have one. Once again, you may or may not have a clamp below this portion of your line. And that completes the antibiotic infusion.